March is Women's History Month. This year's theme is Moving Forward Together, Women Educating and Inspiring Generations. That's exactly what the woman behind one of the largest healthcare providers in Northeastern and Central Pennsylvania did. As Newswatch 16's Mackenzie Ocker explains, more than 100 years later, it's grown into Geisinger Health System.
A portrait hangs inside the Foss home on Geisinger's main campus near Danville. The woman in the painting is 85-year-old Abigail Geisinger. In 1912, she brought a group of people together to solve a problem, the lack of health care in the area. She was one of few people in Montour-County who owned a car back then. Geisinger spent a lot of time taking patients to Bloomsburg, which was the closest hospital at the time.
So she brought together a team to look at bringing health care to Danville. And in 1913, they broke ground on the first hospital here in this part of Pennsylvania.
Abigail Geisinger built the hospital near Danville with money her late husband George Geisinger left behind. Geisinger purchased 6 acres from William H. McGill, adding on 7 acres of what was farmland several months later. The total cost of the project, including land and equipment, was $387,000. The first Geisinger Hospital opened in 1915, featuring 45 beds in a ward with just under 20 private rooms.
It is really just a testament to, what we stand for as an organization in bringing healthcare into rural communities and making sure that, we have what we need to thrive.
Although starting the hospital was Geisinger's dream, she brought in others to help bring her idea to life. Dr. Foss was the first physician leader at Geisinger. He helped to create a strategy and put together the plan for the hospital. Geisinger didn't have the background or knowledge about what goes into building a hospital, so she reached out to experts to help guide her.
Who came and moved to Danville and helped, all of the planning and building of what we've got today. In fact, much of the structure that Dr. Foss put in place is how we operate today.
In Geisinger's first year of operation, the hospital admitted 700 patients. The healthcare system has since grown into 10 hospitals currently in operation.
We've grown to exponentially over the last 100+ years in our community, and continue to look at where else we might need to go to serve the population.
Megan Brocious, Geisinger's Executive Vice President and Chief Operating Officer, says, as a fellow female leader in healthcare, it means a lot that the organization was founded by a woman.
It means a lot that we were founded by a woman who, at the age of 85, identified a problem and decided she was going to fix it. And, she did. She was successful in, achieving her goal.
Until her death at age 92 in 1921, Geisinger was heavily involved with the organization. Now in 2025, as Geisinger plans to expand and modernize its main campus, Brocious tells us they're bringing the past into the present by making sure the community still feels the history when they walk into the new buildings.
We've done a lot of research to pull out interesting information about her and some other I would say key moments of the facility, so we can bring them forward, some of Dr. Foss's history, as well as some other leaders that we've had.
Mackenzie Ocker, Newswatch 16, Montour-County.